Hello, and welcome to today's webinar, Engaging Locally, How Local Health Departments Address Alzheimer's. My name is John Sheehan. I'm one of the Associate Directors of the Healthy Brain Initiative for the Alzheimer's Association. And I want to thank you. Thank you all for joining us today. I hope it's an informative time for everyone. Today's webinar is designed to highlight how local health departments are specifically addressing the growing burden of Alzheimer's and dementia within their communities, and what tools and resources they're using that can assist other local health departments along a similar path. We have the pleasure of hearing from not just one, but two leaders in this arena. And we're also going to hear about an exciting funding opportunity directly related to today's topic later in the session. A few housekeeping items before we get started. Please know, as you just heard, that we are recording today's webinar, so it's available to anyone who couldn't join us today. And in the coming days, I'll email out a link with a link to the recording, a copy of the slide deck, as well as any resources and links featured in today's presentation. We'll be taking all questions via the Q&A box, so please feel free to type those in at any point during the presentation. We'll curate them and have a Q&A session at the end of today's presentation. I'd also like to acknowledge the Centers for Disease Control and Prevention for the cooperative agreement that enables us to offer today's webinar, but please do know that the opinions expressed during the webinar are solely those of the speakers. Before we dive in, I'd like to open up a poll and have you tell us a little bit about yourself. What is your primary area of focus? We always appreciate having this information just to know who is joining our webinars so that we may be able to tailor and offer different opportunities in the future. You'll be able to find that poll either popping up on your screen right now or along the side next to the Q&A feature. To help set the stage for the presentations you're going to hear, I want to talk about Alzheimer's in America. Today, there are over 6 million Americans living with Alzheimer's dementia, and the chart that you see on your screen shows an estimated doubling of that prevalence by mid-century. The bar chart on the left-hand side shows that the cost of caring for those living with dementia will increase in sync, reaching nearly over $1.1 trillion by the year 2050. Caregivers for those living with dementia bear a huge burden, and we can see that women disproportionately shoulder the bulk of that burden. And state Medicaid programs in the lower right-hand side spend a large amount on people living with dementia. From the chart, we can see that per person payments for a Medicaid enrollee with dementia is over 19 times higher than a similar Medicaid enrollee without dementia. So what can we do? What can public health agencies do about this? One tool at our disposal is the Healthy Brain Initiative Roadmap. It is an expertly developed guidebook for state and local public health practitioners to advance, really integrate and advance cognitive health as an integral component of public health. The HBI Roadmap offers 25 flexible actions that are grounded in the essential public health services. And as we're going to hear from our presenters today, they can be easily and readily incorporated and adopted into local health jurisdictions. The HBI Roadmap emphasizes the importance of community partnerships, of leveraging resources for impact, and of reducing health disparities. All of those topics we're going to hear about later today. I don't want to take too much more time, but do want to sing the praises of the two local health departments you're going to hear from. From mid-2019 to about mid-2020, the Boston Public Health Commission and the County of San Diego Health and Human Services Agency participated in a pilot initiative with us here at the Alzheimer's Association. The association, we really wanted to focus on how local health departments are currently addressing Alzheimer's within their jurisdictions, and how could they be further supported to advance cognitive health throughout their communities. I think we all know that local health departments are on the front lines of all health response. The COVID-19 pandemic has laid that fact bare. As organizations that understand the unique needs, the unique health concerns, the barriers that exist within their communities, local health departments are on the front lines of the infectious health response, as well as the chronic condition health response like dementia. We wanted to not only learn about what is currently existing out there, but help further elevate that attention to cognitive health and understand what best practices are out there to assist others in accomplishing a similar level of success. I really just want to commend both of these teams. Before we started the pilot together, they were already pulled in a bunch of different directions. And then halfway through, the COVID-19 pandemic struck, and their time, like all of our frontline workers who have joined us today, their time was stretched even further. Despite that, they continued to lend their time, to lend their expertise to this project. And as a result, we developed a really solid set of best practices and case studies that really frame the local response to Alzheimer's. I know you can't really read any of the text that's on your screen, so rest assured that I'll send out links to these documents, the best practices and the case studies, along with the recordings in the slide deck early next week. Before I turn it over and stop yammering, I do want to just tease that funding opportunity that will unveil near the end of today's presentation, so be sure to stick with us until then. Now, finally, I will stop talking, but I am incredibly pleased to hand over our digital reins to our team from San Diego.
Thank you, John. Good afternoon, everyone. I'm Kristen Smith, and I am with the County of San Diego Health and Human Services Agency, which is our accredited public health department. And it includes departments for aging, behavioral health, and others, as well as traditional public health services. And my role is with the Division Aging and Independence Services as the Chief of Health and Community Operations. And Aging and Independence Services also serves as the AAA, the Area Agency on Aging, for our county. We've had local support for our work on what we call the Alzheimer's Project since 2014. And then in 2019, we became part of the Learning Collaborative that John discussed, along with the Boston group. And now we're happy to say we have a grant from the California Department of Public Health, which is using state general funds to use the framework of the Healthy Brain Initiative roadmap to advance our work and to broaden our focus to include more prevention. We can go to the next slide. So this shows you San Diego County, and we're rather large. We've got close to 3.4 million residents. The area covers more than 4,500 square miles, which is apparently as large as Rhode Island and Delaware combined. We're very diverse. We have a large Hispanic population, as well as Asian American and other ethnicities. So we're now a majority minority population. We have a real mix of urban and rural areas. There's 18 municipalities, the city of San Diego being the largest. 13% of our population is over the age of 65. And if you look at senior citizens across the US, 1 in every 115 of them lives here in San Diego County. We can go to the next slide. So as you can see from this graph, the older adult population is growing rapidly here in San Diego. In 2010, there were nearly 688,000 San Diegans over the age of 55. And by the 2030, that's going to be 1 million. So given this growth, it's crucial that we take the needs of older adults into account as we plan for the future. So it's really good to see more health departments taking a bigger role. Let's go to the next slide. So as the older adult population increases, it's of course also anticipated that the number of San Diegans living with Alzheimer's disease and related dementias will also rise. And I will refer to Alzheimer's disease and related dementias as ADRD. In 2020, the estimated number of San Diegans age 55 and older with ADRD is 100,000 people. And our local newspaper, actually just last week, because June is Alzheimer's Awareness, they took that statistic as an occasion to write a front page story on Alzheimer's and about the various sorts of community efforts that are needed to address the situation. And, you know, ADRD, it's commonly associated with older seniors, but it is important to note that a significant portion of older adults with ADRD are between the ages of 55 and 64. So that's the blue, the bottom strip there. So you can see that takes up about 1/3 of the people with Alzheimer's. And then by 2030, the number of San Diegans 65 and older, it's going to be 74,000. And then you add in that 55 to 64 group, another 41,000, and that brings the number with ADRD to just over 115,000 people. So we can go to the next slide. So we have our work cut out for us. So in 2014, as I mentioned, our county's elected officials, the Board of Supervisors, they voted to launch the Alzheimer's Project. And every year since then, we've done a report. The first one was called A Call to Arms, where we were getting ourselves set up. And it brings together teams of experts and decision makers to support efforts in 4 focus areas: collaboration for cure, clinical, care, and public awareness and education. And so through this, we implemented programs such as our Alzheimer's response team, which is a social work care coordination program for families with dementia-related crises. First responders call our call center and we get them set up. And so the efforts made through this Alzheimer's Project are evolving, and now the goals of the Alzheimer's Project are now aligning with the goals of the Healthy Brain Initiative. So we can go to our next slide. So to put our work in the framework of the Healthy Brain Initiative roadmap, the statistics that I've shared so far, those would be part of the monitor and evaluation domain, which is one of the 4 Healthy Brain Initiative domains. And on top of just those basic stats, in 2018, our Community Health Statistics Unit released 2 reports. So one is a deep dive into the prevalence and all the demographics, different ways to slice it, of ADRD in our county. And the other is on the economic burden in our county, including the healthcare costs and the caregiver burden and the value of caregiver efforts. And so these reports inform our county's efforts with what we're doing and planning as the County of San Diego, as well as our local partners and the community at large. And it's part of our public health MAPP cycle. So these findings from these reports have been shared with our community leadership teams and to inform our community health assessments and our community health improvement plans, the CHIPs and the CHAs. And so the Community Health Statistics Unit, they've also developed a dashboard for Alzheimer's and related dementias for easy access to local data such as hospitalizations, ED discharges, and more. So now I'm going to turn it over to my colleague, Manpreet Moomin. She's with me in the Division of Aging and Independent Services with the county, and she'll discuss our efforts in the Healthy Brain domain, Educate and Empower.
All right, we can go to the next slide. Thank you everyone for having me, and I'm excited to share what the cool things that we're doing here. So here in San Diego County, our efforts focus on increasing public and professional awareness of Alzheimer's disease and related dementias, but also to provide the community with resources and skills to support San Diegans living with dementia and supporting their caregivers. In an effort to do so, in 2019, San Diego County joined the Global Dementia Friends movement by training about 25 community partners and stakeholders as Dementia Friends. Champions, and the champions provide Dementia Friend sessions across the region to dispel myths about dementia and provide tips on how to increase positive social interactions with people in their community who are living with dementia. Within Aging and Independent Services, we also have an outreach and education team that provides various topics, presentations on various topics to the community, including presentations about scams and elder abuse. And these presentations emphasize the importance of acknowledging that those living with dementia may be more susceptible to abuse and to fraud, and explaining why that is. The team also hosts community presentations on the basics of ADRD and disease progression to help build overall understanding of the disease. Next slide, please. One of the really, I think, useful tools we have is the Caregiver Handbook. The Caregiver Handbook was created by the Caregiver Coalition of San Diego, And the handbook provides a variety of local resources and tools to help caregivers feel supported. The handbook includes a resource directory, addresses common needs, financial and legal issues, and even all the way through end-of-life planning. A great thing and a unique thing about the Caregiver Handbook is that there is a chapter that's dedicated to Alzheimer's disease and related dementias. It covers things like behavioral management, tips and tools, and communication tips. And the handbook is actually, it was recently updated, and we're excited to share that we're in the process of translating it into Spanish, Arabic, Tagalog, and Vietnamese. Next slide, please. And another really exciting tool that we have is the Dementia Communications Tip Card. So this tip card was developed with our community partners as a tool for caregivers and their family members, or family members of those living with dementia to utilize when interacting with the public. The card alerts others that the individual they're interacting with has dementia and provides a few tips to support positive interaction. So think about this as something you keep in your hip pocket and say, I am out with my grandmother who has dementia. I can share this card at a restaurant with a server to kind of let them know my grandmother has dementia. This might help with their communication. We also this year created the Dementia-Friendly Activities Toolkit. The toolkit was developed based on feedback we were receiving from our community and some of our service providers. This resource provides simple ideas on how to engage your loved one who is living with dementia. And this was particularly useful for families during the COVID-19 pandemic, when a lot of family members were, in the same space and may not have had the resources and supports they originally had pre-COVID. The tip card was recently translated in Spanish, Arabic, Tagalog, and Vietnamese, and we're currently working on translating the toolkit in these languages as well. So these are just a few resources and tools. And then with that, I'll hand it back to Kristen to talk about developing policies and mobilizing partnerships in our dementia efforts.
All right, so we can go to the next slide. So in that third domain, policies and partnerships here in San Diego, we really did have a key leader at the beginning. That was Diane Jacobs. She was on our county's Board of Supervisors, and she was a driving force behind some of this work. She became interested in Alzheimer's disease when she realized that our numbers were high enough that Alzheimer's was becoming one of the top causes of death, and also that it was putting such a major strain on family caregivers. So with her support, we were able to implement a program with law enforcement, Take Me Home, to assist people with cognitive impairment, and also implement a care coordination program to assist families in crisis. So in the beginning with our work, we just kind of fit it in with the staff that we already had on board. So the people from community health statistics, looking up, doing more deep dives into the data, the people on our staff here in aging, putting together some of the case management work. And then as we had more success, we were basically getting even more support from the county with general purpose revenue. And then by engaging the top medical staff in our hospitals and health systems, along with universities, as well as the Sheriff's Department and the network of aging service providers, we were able to implement more projects and to improve caregiver support and clinical care. And we were able to just leverage those partnerships and those initial successes to gain more funding through grants. So for us, that the partnerships with first responders, the Aging Services Network, and the medical community have been really key. So now let's go to our next slide. Within the domain of ensure a competent workforce, we're working with social service and medical professionals to ensure that they understand not just the disease progression, but also ways to support the individual with dementia and their loved ones. And now, of course, more of a focus on prevention. But medical professionals are trained to identify the signs and symptoms of dementia, understand how to best manage the disease, and they're becoming more and more aware of resources to support the individual and their caregivers. To bring more focus to prevention, in our current Healthy Brain Initiative grant, our team has developed a presentation specifically geared towards public health professionals so that they understand the importance of integrating brain health messaging into existing and future public health efforts and campaigns. For instance, in public health, we have some grants all around cardiovascular health. Well, healthy body, healthy brain. And our first presentation for an audience of public health professionals, that's going to actually be next week. And then we're also working with clinicians to focus more on brain health and prevention at earlier life stages. Let's go to our next slide. Great. So the clinical roundtable, which started in 2014 with the initial efforts and continues today, especially under the auspices of our current grant. And so that's bringing together neurologists and primary care from, in San Diego, we have 4 major health systems that kind of combine, includes primary care all the way up to hospitals. And then we have a system of federally qualified health centers. So the clinical roundtable has representatives from all of those systems. And over the years, the first one was in 2016, they developed a guidebook, Physician Guidelines for Screening, Evaluation, and Management of Alzheimer's Disease and Related Dementias. And then they updated it again in 2018. And this establishes clinical standards, and it's now being updated once more. And then what you see on the right there is ALZDX RX. It's a mobile app that was developed as a companion. It was actually voted one of the top 10 medical apps a couple of years ago. And so that gives the physician access to different screening and evaluation instruments and lots of information. And then conferences and webinars, importantly for CME credit on these guidelines. By having the CME credit, we were able to get thousands of clinicians trained. Let's go to our next slide. So this year, with more focus on prevention, a handout was developed for physician offices to use to promote healthy habits for brain health. And it's actually called Healthy Body, Healthy Mind, because that's what our focus groups and feedback from patients said would resonate more. And this can be incorporated into a doctor's visit, and it will be provided to the patient at checkout. And so this is for patients really in midlife who don't have dementia, but who would have risk factors for dementia, such as hypertension. And then on the right there, to promote early detection and diagnosis, exam room posters were developed to encourage patients to discuss cognitive impairment with their doctors and about any changes that they might be experiencing. And all of these materials are going to be translated into Spanish, Tagalog, Vietnamese, and Arabic, and also perhaps with some tweaks for cultural appropriateness. And then we're working also with the clinical roundtable to share best practices across health systems and embed them into the systems as much as possible. For instance, even what seems kind of like a small thing, like having a place in the electronic health record to enter a score on a cognitive screening, that can have a longer, more sustainable impact. And then in the new version, updated version for the guidelines and on the app, there's going to be more emphasis on caregiver wellness and local caregiver resources. And now we'll go to our next slide, which is pretty much our last one. I just want to let you know, I know we have time for questions later in the webinar, and we also invite you to email either Manpreet or myself if you have any resources or questions and want any of the resources. So I'll turn it back to, actually straight to the Boston group. So.
Thank you, Kristen. Good afternoon. Thank you, John, Alzheimer's Association and NACCHO, for inviting the Boston Public Health Commission today to speak at this webinar and share our experience from the perspective of a local health department that is developing its early stage work in brain health programming. My name is Christine Vu, and I am the Associate Division Director for the Healthy Homes and Community Supports Division at BPHC. I am joined here by my colleague who will help answer questions about her work in the division's injury prevention program during the Q&A session. Teresa, would you like to introduce yourself?
Yes, thank you, Christine. As was just mentioned, I am the Injury Prevention Program Director. My name is Teresa Teixeira, and the information Christine will present over the next 15 minutes covers ongoing and completed work under my program. Christine?
Thank you. Next slide, please. For the time we have together, I will be walking you through a quick background about BPHC and how we got started in brain health work, our approach to healthy aging and brain health strategies, specific examples of our work, the challenges we experienced, and also the opportunities we see ahead. And lastly, I'd also like to share with you a few lessons learned and tips that may help you on your brain health journey ahead. Next slide, please. The Boston Public Health Commission is an independent public agency providing services through over 40 programs, which include the city's homeless shelters and emergency medical services. It is governed by a 7-member board of health appointed by the mayor of Boston. Some fun facts we share about BPHC is that it is the nation's oldest health department, which traces its roots back to 1799, and Paul Revere was named Boston's first health officer. On this slide, you see BPHC's strategic priorities from our strategic plan for 2019 through 2021, which include racial justice and health equity, workforce development, informatics and data, collaborative partnerships. These are the pillars of our work and how we view our path forward. They are important to mention here because much of the work that this team has done is to make sure we crosswalk our vision and values for healthy aging and brain health work to reflect important frameworks, not only to guide, but optimize our work. We'll go over this more later. Before I move on to the next slide, I want to mention a major reason for why it is important for the city of Boston to engage in healthy aging and brain health work. With about 695,000 residents, Boston is the largest city in New England. An estimated 15% of its residents will be 60 years old or over. Boston expects that this number will grow well over 125,000 by 2030. If we look at our current numbers, among Boston's older adult residents, 26% of Black and 11% of Latinx residents take up our Boston's resources and efforts to build the community. These communities are seen to be at higher risk for Alzheimer's. Next slide, please. BPHC started our healthy aging and brain health work in earnest when we engaged in the Prevention and Wellness Trust Fund. It was a $60 million statewide initiative from 2013 through 2017 that was a part of the Massachusetts Healthcare Cost Containment Law in 2012. In this engagement, we focused on 2 Boston neighborhoods, Roxbury and Dorchester, where the population was over 140,000 residents, and Black and Latinx individuals represent 75% of the residents. Apart from pediatric asthma and hypertension, older adult falls prevention was a major part of our slate of program areas. For this work over a 4-year period, BPHC received $6 million. Next slide, please. So I won't read everything off the slide, but I wanted to share with you how from this project we learned time and time and again that strong, strategic, and routinely collaborative partnerships helped our city succeed with this model. Some of this work that strengthened relationships with our community health centers and older adult focused organizations like the Age Strong Commission and Ethos also paved the way to help us build a foundation and a history of success for infrastructure and capacity building, which includes staff training, community and clinical linkages, which elevated the work of community health workers by hiring them and advocating for their part in this work, since they interface and support many Boston families and individuals. Standardizing clinical care, such as screening, increased services, and last but absolutely not least, advancing health equity. Next slide, please. Now that we've gotten a taste of our past work, you'll see echoes of these efforts building the foundation of our current work in brain health. The strategies we formed looked at these 3 main things: capacity, partnerships, and vision. We looked at our existing programs and functions, and we figured out that we can do this, we can identified what we can do first and with who. So using the Brain Health Initiative roadmap and the BPHC strategic plan were also helpful in creating our vision for the future. What you see on the slide is a bit of a mix of both, the what now and what's next, because we're still growing and expanding our healthy aging and brain health work. Presently, we continue to implement concussion and falls prevention work within our injury prevention program. And those of you who have questions about this, you can ask Teresa during our Q&A session. If you recall earlier, I mentioned that the BPHC strategic priorities are from our strategic plan for 2017 through 2021. So it's prime time now for us to advocate for BPHC and our city to include older adults, healthy aging, and brain health into our strategic plan and community health needs assessment, which would be an extension of our health equity work. That is what we will continue to do. Partnerships are also critical to our work. As we continue our work with our city colleagues at the Age Strong Commission, we also look to our community partners to help build on our future for this work. We're particularly excited about developing our relationship with the Massachusetts and New Hampshire chapter for the Alzheimer's Association. Training staff is also key, especially with the intention of better supporting caregivers and residents about dementia and Alzheimer's. We also look forward to securing more funding to establish a training network for providers like primary care physicians in the Boston area. In order to continue our connection to the community, we also regularly create new health education content for the media, including social media and other engagements to help elevate our residents' confidence in how they may support brain health and falls prevention. Lastly, we are always on the lookout for additional funding to deepen and broaden the services and offerings we provide for healthy aging and brain health. Next slide, please. On the slide, you see a few examples of how we've engaged our community and how we've spread the word, even with limited resources. In February of this year, we collaborated with the City of Boston's Age Strong Commission to conduct a dementia-friendly training for over 150 community workers, community members, and caregivers. We also continue to implement prevention programs such as traumatic brain injury prevention education and training, pedestrian safety and road design, as well as creating and distributing community resources to promote brain health. These community resources are also shared into social media. We are also in the middle of working with our colleagues in our bureau to see how inspectors and community health workers may refer residents who they see during home inspections or visits to resources they need. Some of the partners to whom we refer include the Alzheimer's Association and the City of Boston's Age Strong Commission. Next slide, please. Securing more funding, particularly grant funding, is an eternal challenge for many local health departments, and we are not an exception. We have attempted to apply to a HUD and CDC Bold grant, but we were unable to receive funding. While Teresa is doing amazing work in the injury prevention program, to go beyond what we are doing now in a meaningful and sustainable way will require additional funds. Our division and BPHC continue to look out for additional funding for this work. Even while we do this, all of us here on this call and our colleagues are confronted by the formidable task of COVID-19 recovery. At BPHC, while we continue our programs, it is particularly more difficult to carve out additional resources when the agency is rightfully focused on committing much of its energy into making sure our city stands strong through this time and beyond. Even with these hurdles, we see opportunity. We now look to determine what is possible and what we may pilot and scale into the future. This in part also works into our future efforts in strategic planning at BPHC. We also continue to identify and talk with potential organizations to not only partner up in our grant proposals and existing programs, but also be active partners in their own grants. Some of the organizations we have connected with and look forward to connecting with or working with are the Multicultural Alzheimer's Prevention Program at the Massachusetts General Hospital, the Archdiocese of Boston Hispanic Latino Ministries, and the Geriatrics Section at the Boston University School of Medicine. We are also working to elevate how we train our public health workers and colleagues in healthcare. Some of this work we hope to establish with the BPHC Community Health Education Center, which we call CHEC. There, we look to train community health workers, caregivers, providers, and residents about how they may each play a role in improving prevention, diagnosis, and management for Alzheimer's disease and related dementias. Next slide, please. So from what I shared with you so far, a lot of our work comes from thinking about where we may start smart, grow strong, and scale high. And this is in the context of a local health department getting started in healthy aging and brain health with some, but not a lot of prior experience. And while I mentioned smart, I also mean setting and implementing goals that are specific, measurable, attainable, relevant, and time-based. This isn't on the slide, but an overarching lesson we learned is to start small and keep going even when you don't have funding. And there's always something you can do. Do you have community health workers speaking to families about their child's asthma? Well, perhaps that's a good time to offer some materials about brain health, since it is an important part of our lifespan approach to health. We also have many families that live in intergenerational settings, so this approach is also very helpful. Another tip is to use the action agenda in the Brain Health Initiative Roadmap or its executive summary, along with your agency's or department's strategic plan. Identify where the agency work is already aligned. In this space, you will also be able to brainstorm what may be cost-effective or cost-free. Next, study and strategize. The Alzheimer's Association provides a wealth of materials on its website and through its chapters. One research resource that I particularly like are the case studies, because it helps us see what other folks are doing and how they made that happen. Lastly, broaden your horizons. Identify internal and external partners early in your planning process to take inventory of your collective capacity and potential. This is a time when you can brainstorm how you may elevate and amplify existing work, as well as build pilots or new programming off of current or anticipated resources. A lot of creative opportunities exist within partnerships, internal and external alike. Your next program idea may just be a phone call away. Next slide, please. Thank you again for your time and interest. And if you have any questions, please feel free to reach out to me by email at cbu@bphc.org. And Teresa and I look forward to your questions in our Q&A session. Thank you, and we will now move on to NACCHO.
Thanks so much, Christine. It really is an honor to join both San Diego and Boston on today's webinar. I've had the pleasure of working for the Boston Public Health Commission and partnering with Aging and Independent Services in the past. And I can think of two no better communities that have really been very progressive in this space. And I'm honored also to collaborate with the Alzheimer's Association on this. So by way of introduction, my name is Peter Holgrave. I am the Senior Director of what NACCHO calls our Public Health Infrastructure and Systems team. And really what I want to contribute to today's dialogue is just to give a high-level overview, I think, of some key resources and frameworks that might help inform how you bring some of this work to light. How do you get some energy with your cross-sectoral partnerships to be able to advance this work together? Next slide. In case you don't know, NACCHO, or the National Association of the County and City Health Officials, we are the national nonprofit that represents the nation's roughly 3,000 city and county health departments, by which we provide capacity building assistance to federal advocacy and other activities. Next slide. First, I wanted to start off with a poll for you all to participate in, which is to answer the question, which is going to pop up in a moment. Are issues related to dementia included in your current community health improvement plan? Please click yes if you think that that's the case, no if you know it's not in there, or if you're not sure. And as you're participating in that, the reason why I asked this question is, whereas we certainly see great examples of how healthy aging and dementia-related issues are in community health improvement plans from communities like San Diego, Boston, and others, it's actually quite rare. And what we often see is that health departments or hospital systems, whether it's their CHNA or job process, typically see these things in silos. We almost 90% of the time will see strategic priorities around chronic disease conditions. We often learn about the role, whether leading from the front or behind, in terms of health departments engaging in supporting community falls prevention classes, for example, or chronic disease prevention classes, et cetera. They're not explicitly indicating healthy aging per se or dementia. And I think that's a good reminder for all of us to think about what is the value proposition behind embedding dementia and related issues into our CHA-CHIP process, because that will help really speak to what Christine has mentioned, which is it won't get into a strategic plan, it won't have resources dedicated to it, and it won't have the longer term commitment and attention unless it's embedded in those plans. Next slide. And I've seen that a number of you clicked that you weren't sure, and either that means you're part of your CHA-CHIP process, but perhaps you don't, it's not as fresh in your mind. We certainly don't want those chips to be sitting on your shelves gathering dust. We really want them to be active. But this is really just a reminder as to the importance of that. So we know that most health departments engage in community health assessment and planning processes to really help to think about these issues and the priorities within their communities from a systemic standpoint. It really helps to address the who are we trying to serve or improve their health, what are we trying to do, which is your community health assessment, and how are we going to do it. And even for those of you that might have a CHA-CHIP or a CHIP that's recently been concluded, ideally in an ideal world, including with COVID, we now have an opportunity to refresh those plans in light of COVID and because of these other issues that have come to light. There certainly is a lot of comorbidities as we are increasingly learning between healthy aging and COVID, for example. Next slide. And so why is that important? Well, again, community health improvement plans are meant to be, in essence, a partnership, a health department, a hospital system's commitment to committing time and other resources to addressing key priorities that have been identified, through a community health assessment process. And it really helps to clarify and establish and to promote what is your vision for your community. And I just love this graphic that was developed by the National Council on Aging that not only talks about the issues of equality and equity as we're used to talking about, including the social determinants of health, but also what does it mean to remove the wall? What does it mean to address the issues of justice that are related to the social and structural determinants of aging in this context? And then most importantly is, what does inclusion feel like, whether it's the caregivers of loved ones with dementia or those suffering dementia themselves? What are we doing to make sure that our vision for our community is all inclusive, to make sure that how we prioritize health and how we come together in partnership with each other is really meeting those ends? Next slide. And of course, the other purpose is that how often when you're conducting outreach with your community, especially for a community health assessment process, do you have those voices at the table? Are you making sure that it's not just the clinical providers, but also the non-for-profit often or community-based organizations providing services who represent the caregivers, who represent those who surround dementia care patients, if you will, and community members. So making sure that their voice is at the table, if you will, when it comes to setting that community vision through a community health assessment and improvement planning process, we think is critical, because that ensures that the assets and the needs of the community are comprehensive. They're thinking about these issues, not just in silos of, say, chronic disease conditions, but across the life spectrum. And that very specifically, given that most health departments are serving jurisdictions, as we've heard from San Diego and Boston, that are increasingly older in age, these are types of the issues that we need to prioritize as local public health practitioners. Next slide. And of course, this filters down. So exactly to the point that was made by Christine, having something embedded within a 3 or 5 year plan at the CHIP level really make sure that your strategic planning is hinging upon meeting those strategic priorities, which will filter into those programmatic interventions so that we see them. This is a continuous ongoing cycle. It's not we've done our CHIP 2.5 years ago, I'm not going to think about it for a while, or last year. It's supposed to be a document that's supposed to be a living document that should filter through all of population health practice through that strategic planning, action planning, sustainability planning, efforts and activities, whether it's to get the resources that are needed to provide those programs and services that you've just heard some great examples of today. Next slide. So just very quickly want to introduce some resources, and this is mainly a teaser so that whether you're going back to this slide deck after today's presentation or listening to the recording, this is an invitation for any of you to reach out to NACCHO. We have quite a bit of expertise in the performance improvement space and know a lot about tools that have been created that could be really advancing your healthy aging journey, employing performance improvement techniques. Next slide. One that I hope you're aware of, but maybe you have not thought about in terms of healthy aging, would be Healthy People 2030. Recently just launched, NACCHO is a national partner of HHS on Healthy People 2030. For those health departments and communities that don't have the bandwidth to establish their own benchmarks around, am I moving the needle on all things healthy aging, including dementia? I would definitely recommend that you take a look at the objectives and some of the benchmarking and targets that are related to healthy aging, including dementia, that are in Healthy People 2030 to inform your improvement planning, your strategic planning, as well as your programmatic plans. And then a framework that we really appreciate and increasingly more health departments are becoming aware of is the BARHII framework, which stands for the Bay Area Regional Health Inequities Initiative. Even though it started in the Bay Area, the model has become extrapolated and it resonates across the United States. They're a close partner of NACCHO's. And I would recommend that you look at their website to see what their resources are to help you on your journey for moving from, if you will, the right side of this diagram to the left side, meaning that we all know that it's extremely important to provide services that alleviate the burden of morbidity and mortality related to dementia and other healthy aging conditions, and to do so at an individual and interpersonal level. But it's also important, as we all well know, and this speaks to the Healthy People framework, to address what are the social determinants of health that surround us, what are the living conditions. I can think of no better time than our current moment with COVID, especially with movements like Black Lives Matter, raising really critical issues that have existed for a long time but have become increasingly exacerbated. It's also very important for all of us to become increasingly comfortable with how does our efforts addressing healthy aging downstream, middle stream, move to the upstream, meaning how do we address the structural determinants of health related to class, ethnicity, structural racism, of course, gender, orientation. What is our role from a policy perspective, whether it's the policy within my agency or the local or state level policies that really impact and serve as those root determinants that impact all of the work that we do across this chart. Next slide. Here's an example of a tool that you can take a look at, a survey that you can do within your health department or in collaboration with your partnerships to really assess what are your competencies and levels of commitment and where can you go next in terms of addressing the health equity issues related to health. Next slide. Another one that we do trainings on, but this is just an introduction to it, is what we call the Community Health Improvement Matrix, which is simply being able to do some asset as well as gap analysis within your health department or with your partnerships to be able to kind of map out where are we putting our energy right now and where do we need to go. For example, we often find that most health departments focus a lot of their resources on the immediate needs around individual interpersonal care, for example, from a tertiary standpoint. What does it mean? And we receive far less energy or activity, I should say, sometimes for very obvious reasons, including funding, is going to the upper right-hand corner of this chart. So what does it mean to get to the contextual level, the prevention level, that really looks at the entire ecosystem of your public health local system, try to move the needle on dementia and related conditions, going from the early stages or prevention stages all the way through that cycle. So you could go to our website and learn more about how you can use this as an activity, kind of plot out what are your current activities and where there's some gaps where we need to form some alliances to really have a much more comprehensive approach in addressing all things healthy aging and dementia related. Next slide. And then quickly, our most long-standing framework, which really connects all of these pieces together. It starts from how do you develop a shared vision among all of your collaborators, partners, and community members, to how do you develop, how do you form a really good assessment process, to how do I identify strategic priorities that result in sustained action, is our Mobilizing for Action Through Planning and Partnership framework, which continues to evolve to this day. We have a blueprint to continue to evolve it, but we have more than enough resources to help you as a health department connect with MAPP communities, which there are several hundred nationwide, and those different groups to expand your network of stakeholders to be able to engage in this work. So certainly this is a framework that speaks to all of those different aspects of that CHADSHA process, but also that cross-sectoral partnership development and visioning process that's really integral to think about from a healthy aging perspective. Next slide. And I know I need to wrap up, so I'm just going to say that the kind of the magic sauce to the MAPP approach is really shifting away from just thinking of the health department to community and thinking from a strictly medical model to one which is really looking at more that ecosystem from a health equity perspective, from a systems perspective. Going from we know everything as public health professionals to everyone knows something, and we need to bring them to the table as co-creators and leaders in this space. Next slide. Lots of great benefits to MAPP, which you can read about later. Next slide. And we have lots of resources to help you, whether it's this MAPP framework I just introduced briefly, or to help you with planning in general, whether it's short-term or longer term, to think strategically about metrics and proven and evidence-informed practices that really help you address issues related to healthy aging, as well as dementia-related concerns. And now I will pass it back to Megan with the Alzheimer's Association.
Thank you so much, Peter. It's been great today to hear about all the important work being done locally, and kudos to San Diego and Boston for all the great progress you've made. My name is Megan Fidel, and I'm an Associate Director with the Alzheimer's Association. And building on this great effort at the local level, I'm very pleased to announce an exciting funding opportunity designed to support health department action across the country called the Roadmap Strategist Initiative. The purpose of the Roadmap Strategist Initiative is to increase the capacity of local health departments and their community partners to address dementia. And it's worth noting that this is a part of and funded by our larger Healthy Brain Initiative, which, as you know, is a collaboration with the CDC and the Alzheimer's Association that aims to enhance state and local public health action. The initiative is duly sponsored by the Alzheimer's Association in collaboration with NACCHO. And on the next slide, you'll see that the program will fund up to 6 health departments or partnering nonprofit hospitals or health systems who will be selected through a competitive application process to participate in a 15-month funded program. This funding will be used to establish what we call a roadmap strategist. So the strategist will be a public health professional tasked with being a system change agent. This is an excellent opportunity to be a part of the nationwide transformation in public health and dementia. And we encourage you to learn more by reaching out and by visiting the submission page for more details. Now we want to take some time for questions for our speakers today. As a reminder, please go ahead and type any questions you have in the chat box. And we do have a few that came in early on. Just pull those up. So I know Christine spoke quite a bit on funding and where funding came from. I wonder if Kristen might want to weigh in on this as well. So the question is, where is funding coming from for the operations of these initiatives? Is it financed through municipal funds, private partnerships, or charitable giving?
So I think this was in response to our San Diego presentation, and we are very fortunate that we've had local county general purpose revenue to fund a lot of our efforts, several million a year actually. And that's gone to case management programs, to the Take Me Home program, funding part of a position at the sheriff's, as well as a little bit of staff time within our division. And then we've had federal grants from Administration for Community Living for their Alzheimer's disease initiative, and now the California Department of Public Health grant for Healthy Brain Initiative. So I do think that success kind of begets more success, since funders like to make, they want to know that you're going to succeed. So I think we've been able to establish some momentum, I guess you could say. But I do think for others who maybe are starting out with a different local situation, just starting small and building upon that.
Thank you. Another question we had come in, I believe, to some of the resources that you spoke to in San Diego is about whether they've been integrated into a MyChart or a virtual system as well.
Sure. So each of our health systems has a slightly different electronic health record. So like one health system with UCSD uses MyChart, another one uses something else. I know Epic is used in some, maybe all of the health systems, but it's different depending on the particular version of Epic you have. And I know Epic, our physicians have been working with the people at Epic to integrate things even more. And from what I understand, it can be a little bit frustrating because there's so many varieties of Epic. and I don't know all the ins and outs of it, but I think that if you're using it in one place, it doesn't mean it's the same thing that you're using in another place. So, and then our, I think, yeah, this question about the screening tool. So Alz DXRX. So I'll put our Alzheimer's project URL in the chat, and then you can go there. And if you click on the clinical roundtable and follow the links, you'll get to, it's called Champions for Health. They're the medical society, and they oversee the work of the clinical roundtable, and you can like download the app there and you can see all that's in it.
And if you don't mind, I wanted to also add to the funding question. So
Yeah.
This is Peter with NACCHO, and just from our perspective, what we have also seen is, so there are foundations dedicated to healthy aging. Not to say that's something that everyone on this call is going to run to them and they'll be blessed, but the Hartford Foundation, for example, has been a great champion in this space for a very long time. It's our hope from NACCHO that there'll be more funders who will be prioritizing, in that space. But there are regional, state level, and other foundations that do prioritize this. The other perspective I would say is we have seen some health departments be successful leveraging funding from their state health departments to the prevention block funds dedicated to healthy aging. And I can't say that that's a huge chorus, but we have seen some successes there. So depending upon your relationship and the priorities of your state health department, I think there can be cases made as to why this is a priority at the local level, of course. And then I would also suggest that but I don't want to give the impression that only large health departments are doing this really well, right? We also have several, if you will, smaller size health departments, depending upon your jurisdiction, including those that are more rural in composition, that are part of the Healthy Aging Communities movement, which is a whole other body of work that's excellent, that dovetails with everything we're discussing. A lot of that, again, is funded by Hartford, but also other localized foundations that are really advancing in this space. So I think there's you have some great peers out there from which to learn, and maybe that could be an avenue for which NACCHO could play, is connecting with other health departments who are also active in the space, in addition to the excellent example of San Diego and the Boston communities, so that you can learn from them. I would also say that most funders want to see that you already have a coalition focused on these issues. So even if you don't have funding, again, whether it's through that chat process or something else, I'm hopeful that from today you'll think about partnerships differently and think about whose voices do I need to bring into the conversation to inform strategy, so that you have something that's a little bit more formed to be able to go to those funders and really make a compelling case, which I think you can.
Thank you. We have time for just about one more question. And this one is about access to healthcare. This person says that they're seeing that for those who have limited insurance or no health insurance, there's a huge gap and a need for basic access to healthcare. They're saying the project is wonderful. How does it address the lack of access to healthcare?
So I think that one might have come in early on, so I think it might be directed to San Diego. And while our project itself hasn't had a large focus on health access in general, certainly within the county, we do have a focus on that. In San Diego County, I'm the liaison to our Medi-Cal health plans, we call Medicaid Medi-Cal, and it's from 1/4 to 1/3 of San Diegans are actually on Medi-Cal. And so people on Medi-Cal might be in any of our different health systems or in our federally qualified health centers for their primary care. And then of course the centers would also see people who are uninsured. But that is always an issue, and it's kind of part of a separate equity efforts to always try to increase and improve access.
Okay. Thank you so much. And that concludes the time we have for questions. Today's webinar and our discussion have helped highlight the way local health departments can elevate attention to healthy aging, cognitive health, and dementia by aligning with existing public health efforts and definitely working with partners. I know that's a theme that really came out from today's discussion. We've also seen how a dedicated public health focus on dementia can help improve health outcomes. And we've heard from the Alzheimer's Association and NACCHO on some valuable tools to help guide local health departments. I want to thank everyone for attending today. Please be sure to complete the feedback form. We'll share a link in the chat as well. We're looking forward to any valuable feedback you have to help inform future offerings. And please note that slides and a recording of the webinar today will be shared within a week. Thank you all and have a wonderful day.